Bone and Joint Playbook with Dr. John Urs. Tips for pain-free aging. Dr. John Urs is a board-certified orthopedic surgeon with over 35 years' experience in the Dayton, Ohio area. He is also a clinical fellowship-trained surgeon in total joint replacement from Harvard. This episode is brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
Well, Dr. John Urs, we are back with something kind of different. We're doing something called the 7-minute drill, which is a very fast-paced look at certain orthopedic topics, correct?
That's correct, Terry.
All right, let's get into it. But you're going to give us a warm-up joke. What's a warm-up joke?
Well, I just thought, since we're trying something new, we should both know that anything worth doing well is worth doing poorly at first. So we're going to jump right into this short podcast so we can get people to listen for a short drive, maybe to and from work, or when they have just a few minutes instead of a longer amount of time for a regular podcast.
So the hope is we're going to do more of these short podcasts that are 7 to 8, 10 minutes, something like that.
Yeah, and people have the choice of listening to a 30-minute one or maybe a 10 or 7 to 10 one.
Well, the idea is people don't have the attention span that they used to, so we're going to keep it short to keep them entertained.
Well, and that's true. And I will also comment on our shirt colors. In October here, we're going to have Halloween coming up, so Terry's wearing orange. I'm wearing some pink for Breast Cancer Research Month.
That's a nice shirt.
Yeah, so hey, here we go.
Okay, so the topic today is shoulder separation, correct?
Well, even more precise, it's collarbone separation.
Collarbone separation. Okay, what is the difference between a shoulder and a collarbone?
Well, if you reach on the top of your shoulder, you'll feel your collarbone in the front.
Yeah.
It meets the top of the shoulder blade, and that's called the acromion. And a collarbone separation is called an AC separation because it's between the acromion and the collarbone or clavicle. The shoulder joint is down below. That's a ball and socket joint. So when a ball pops out of place, that's a dislocation. We're not talking about shoulder dislocations today. We're talking about injuries to the top of the collarbone, which usually occur when you land against a wall, you get fall off your bike and land on your shoulder, and that causes the injury to the top of the shoulder where the collarbone separates from the edge of the shoulder blade, and that causes this thing called a collarbone separation.
So separation is different than dislocation.
Well, as one of the movies said, there's varying degrees of separation. So a collarbone separation is in various degrees, called first, second, third. It goes all the way up to 5 and 6. But a direct blow to the collarbone causes no separation, but it's an injury to the joint. The bone isn't offset. A partial separation, like halfway where the collarbone sticks up, is what's called a second degree or partial separation. But when it completely separates from its little attachment to the acromion, called the top of the shoulder blade, that's called a complete dislocation, which means it's not located where it should be. It's dislocated. So a collarbone separation is easy to tell. You put your hand on the top and there's a big bump there now instead of a smooth surface. Hippocrates, from the ancient Greek days, said that a blind man can diagnose a third-degree AC separation. So you can put your hand across the top, feel this bump with your eyes closed and go, your collarbone got injured, didn't it? Some of the famous basketball players, Larry Bird, Kevin McHale, have 2 of those. And they're very kind of benign, I would say. Most of these don't need to be fixed. We'll talk a little bit about that.
All right.
But these are common injuries because we lead with our shoulders with football tackling, bike injuries.
So that's how they happen.
Flying into the walls, trying to get a rebound in basketball.
What's the most common way these things happen?
Probably a fall on the top of your shoulder, just directly on it. That's why we have shoulder pads.
Fall on the top of your shoulder? How do you fall on the top of your shoulder?
Well, let's say you're going to fall and you don't want to put your hand out and break your wrist. You might tuck your arm down.
So it's a football injury.
Or let's say you fall over the front of your bicycle.
Okay.
Like the bike hits a log, you flip forward, you land on the top of your shoulder. you may see some stars. There are x-rays you
See
can
some
use.
stars.
X-rays can be done to show the collarbone separated.
Right.
I recommend people get an x-ray for this because there are fractures that can occur where you break the bone that may be treated differently. So if there's no fracture and the collarbone separated, it falls into these categories of collarbone separations. And most of these are easy to diagnose. You don't need MRIs. Plain imaging is usually all you need.
Okay.
And then we talk about some things we can do for them.
So tell me, how do I repair them? I mean, if I'm coming to you with an issue, what are you going to do? How are you going to fix me?
Well, I'm going to tell you right now, it's a skilled surgeon.
It's a skilled surgeon.
Who knows when not to operate. So most of these never need surgery.
Really?
I ask my patients, do you want a bump or a scar on the top of your shoulder? And most people pick the bump because the bump you can feel, but it really doesn't impair your function of your arm.
I'm trying to figure out if I had one. Do you think?
I have one on mine, and I've never had it fixed.
Okay.
So Kevin
Well-
McHale, Larry Bird, famous basketball players,
Yeah.
they do just fine. And sometimes these don't cause a problem. There are some more serious kinds where the bone gets stuck under a little edge of muscle,
Yeah.
or it buttonholes up under the skin, and it's way out of place. Very dislocated would be a word. But sometimes those are fixed. Now, if you had pain with this over time, and you said, I hate the bump, my arm's killing me, I can't do my 360 slam dunks, then there are surgeries to actually push the collarbone down because you've torn some little ropey structures called ligaments that hold the collarbone down. But short of repairing those ligaments with a graft or some type of suture or what they call an augment,
Right.
you will have a bump the rest of your life that you can show people at parties. But again, if that doesn't bother you, it certainly doesn't bother me.
Okay. So as we land this podcast, is there anything we should talk about that they should know, because we're trying to do short topics and get it done quick? What have we missed?
Well, we've missed, when can I get back to doing things after this?
Okay.
These injuries are a nuisance. Some people are back within a week or two, doing a lot of normal activities. We ice them down, the acronym RICE, rest, ice, compression, elevation. You wear a sling for a few days.
You may know that acronym. I don't know
Well,
that
I just
acronym.
told it to you. So these things will help you with getting through the first few weeks.
Yeah.
I tell people with shoulder injuries, they're going to feel more comfortable in a lazy boy, not laying flat. Get some ice on it. Turn on a Netflix, and you can eat your Ted's dressing
Eat
and
your
your
Ted's
salad,
dressing.
and you can just let this get better, because most of these get better over time. Sometimes therapy helps it along. Most of the time, surgery can always be considered later,
Yeah.
but usually never early in these, because most of them get better without surgery.
Okay, well, this has been the very first episode. It's kind of a trial of the 7-minute drill with Dr. John Erce. We're going to be doing some more of these just to put them out there, and let us know what you think. So if you see these on YouTube or on his website or out there on Facebook, let us know if you have a question or you want us to cover a topic. We'll be happy to do that for you folks. So this has been the Bone and Joint Playbook 7-minute drill with Terry O'Brien and Dr. John Erce. See ya.
Thanks, Harry.
This episode is brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.